All right. Well, thank you, Melissa, and thank you, Matt, for the invitation, and to all of Sages for the privilege of the podium. So my talk is mesh, near and dear to my heart. Here's my disclosure slide. It is relevant for this talk. I consult and teach for a couple mesh companies, and lo and behold, I'm talking about mesh. So as the previous speakers have already talked about, chronic pain is a potential issue with a lot of these repairs. The numbers that we see, 5 to 12% is what Shirin has really demonstrated. Some studies even show can be up as high as 75%. That doesn't mean that's severe pain that high, but even people with minimal pain can be prolonged. Why are people having pain? Well, we've already discussed a lot of that. There's a lot of causes from a surgical repair. Is it the degree of dissection, too deep or severe of a dissection? Is it due to fixation, tacks, sutures, versus other forms of fixation? As David nicely showed, what about nerve distribution and either division or disruption or even injury to those nerves, as well as the history of previous repairs, recurrence, and of course there's the potential for issues with mesh and foreign body response. When patients come to see you, even talking and discussing mesh with them, it can evoke fear and anxiety in a lot of these patients, whether it be from legal ads, the lawyer ads they see in the middle of the night, or if they go to social media. I went to Facebook and searched mesh, and this is just a small spattering of the groups that came up with sort of anti-mesh and mesh concern, mesh support groups. But there actually is one more mesh group that came about. Let me turn it down a little bit, a little loud. So it turns out that, what's that? Yes, party up. So it turns out there actually is a good positive mesh group out there. It happens to not be a mesh prosthetic group, but a band called Mesh from the UK. So I figured I'd include that in here. Their song, The Fixer, I think was very apropos for a mesh talk. So they have a new fan now. But mesh isn't perfect. There are potential complications of it. Whether you get excessive contraction and shrinkage, that mesh can fold, it can crease, it can clamshell if you're doing laparoscopic or robotic repairs. It can ball up and form a meshoma, as already discussed. That mesh, if it's adjacent to other structures, can erode into other structures, form fistulas. And of course, chronic pain is a big issue that we're always concerned about. And then even if people don't have severe pain, some people do have a sense of this foreign body sensation that can be persistent. So one of the things I always like to look at when we talk about mesh prosthetics, regardless of the type of repair, is what is the reaction to that upon implantation? And I want to highlight some animal studies that we did in the lab. So it's not just the material. That's a big part of it. What's it made of? Polypropylene, polyester, PTFE? Is it lightweight or heavyweight? But what is this reaction upon implantation? Does it induce a severe inflammatory or foreign body response? And so, if we look at meshes, it doesn't matter what material you put in there, any foreign body is going to do some degree of inflammation. Some just induce it more or less than others. How about foreign body response? When I think of foreign body response, I think of things like a splinter. Somebody gets a splinter, the body tries to wall that off. You get these coalescence of macrophages called foreign body giant cells. When you see a foreign body giant cell, that's the body's way of saying something ain't right about that material. If you implant things like PTFE and polyester, these are from our own animal studies. You have severe foreign body reaction, foreign body giant cells surrounding all these mesh fibers. Even newer monofilament polyesters can also result in foreign body response. Again, around in each of one of these mesh fibers, you're getting this significant inflammatory and foreign body response. This can also happen with other materials. So this is going back to PTFE and polyester. In addition to foreign body response, the other thing we want to see is that fibrotic response, the amount of scarring that can happen to and around a mesh. Things like PTFE, which are rarely seen in inguinal hernia repairs. I'm glad that Shirin showed that study with the inguinal repair with the PTFE. I was shocked to see that because it's such a rare mesh we use, especially in the groin. And what happens, you get this thick, severe encapsulation that can lead to fibrosis and contraction. And while this is not an inguinal repair, this is an umbilical repair that came to see me, this is the kind of reaction that you get with certain materials like PTFE, where you get this contraction. And when you get some dual layer meshes where you have a polypropylene on the peritoneal side, when you get excessive contraction of one material versus the other, that can actually expose other materials that were meant to be hidden from the viscera. And polypropylene is also another material that gets a reaction to it. This great paper by Cobb, Kircher, and Henneford about the argument for lightweight mesh really led to the development of lighter weight materials for use for hernia repair. And if you look at different polypropylene densities and porosities, starting off as sort of a micropore, sort of a Marlex kind of mesh at the top, medium weight in the middle, and a ultra lightweight at the bottom, all that blue is pointing to thick collagen and this fibrotic reaction to it. So for lighter weight meshes, if you can make the caliber of the fiber a little bit smaller, stretch the pores a little bit bigger, while you do get an inflammatory reaction, you get less so of an inflammatory reaction. But there are other meshes have been developed over the years to try and mitigate some of that inflammatory response. Materials like PVDF, which has been used in Europe for over a decade with decent results, adding these kind of materials helps resist degradation, hydrolysis, as well as the foreign body response. Unfortunately, materials like this and this other mesh, we don't have a limited availability in the United States, but again, they're using it in Europe and around the world. Titanium, this is basically polypropylene that they've covalently bound titanium to the fibers to sort of hide the reaction to the polypropylene. You're getting less inflammation and reduced foreign body response. But what does the data show? And some of these studies have been shown already during this meeting. If we look at this study is about 10 years old, but it looks at over 2,500 patients. And what they showed that mesh reduced the risk of a hernia recurrence compared to Schuldeis, but it said Schuldeis was superior to other non-mesh tissue-based repairs. But the interesting finding of this study, again 10 years ago, was that there was no significant difference in chronic pain and complications between a mesh and a non-mesh repair. Another study that was just published last year looked at over 6,000 patients that showed that mesh, again, reduces the risk of hernia recurrence. It did have a somewhat higher surgical site infection and seroma rate. But the interesting thing about this study is they couldn't really evaluate pain critically in this due to the variations in the methodology of all the various studies they used in their meta-analysis. Another big study that was published last year, though, looked at over 5,000 patients with pretty good follow-up in it, and what they found was that there was no significant difference between non-mesh and mesh repairs. With the one exception is that for the bilaminar meshes, like the Prolene hernia system, where you have a mesh in the anterior and the posterior plane, they did see significant increases in pain from that particular mesh prosthetic. Just to throw another kind of study in there, not necessarily for chronic pain, but male infertility. This good review and analysis looked at over 36,000 patients and basically showed that while you can have some short-term loss in sperm motility, long-term hernia repair with mesh, it doesn't matter if it was open or laparoscopically, has no significant effect on male fertility. What about self-gripping or self-adhering meshes? There's a couple meshes on the market. I'm aware of only one that's available in the United States. There's a couple available in Europe. And just like some of the other studies, there's no significant difference in chronic pain or foreign body sensation compared to a classic sutured Lichtenstein repair. So while there is a benefit and perhaps reduced operative time with self-gripping meshes, there was not necessarily a benefit from a pain standpoint with these meshes. And I'm going to kind of end with mesh plugs. This is a mesh plug. So when I was a resident, I certainly placed plenty of these. But if you look at the data, it shows that there is similar pain with these. And there's actually some conflicting data. There are some studies that show increased pain with them. There's a lot of studies that show that it's equivalent with it. But the conclusion of this, the big study from the Hernia Surge Group and the international guidelines was that there's no added benefit for adding a plug, but there's a potential risk. Increased foreign body response from all that foreign material that you put in that canal or whatever place you put it, and as well as potential erosion. And so they have basically a very strong recommendation to avoid structures like mesh plugs, as well as the bilaminar meshes, because you have foreign materials in more than one plane. And just to show you kind of a couple things, this is a patient that came to see me. He had plugs in both his direct and indirect space. And he had chronic pain to see me, and I went through the whole workup, as Sharon nicely demonstrated, MRI, injections, this and that. Bottom line is, this patient had to have his plugs removed, and this is a morbid operation. Trying to remove this, trying to save this guy from chronic pain. It destroys the floor. I did have to put another piece of mesh, obviously, to repair this, and he is improved, but not perfect. So sort of my mantra for mesh plugs is this: it's just not necessary for the vast majority, if all of our repairs. So in summary, postoperative pain after inguinal hernia repair can be multifactorial. There really is no added benefit to mesh plugs or bilaminar meshes. Reduced hernia recurrence is seen with mesh, though Schuldeis has the best data for tissue-based repairs, and there really is no difference in chronic pain with the use of mesh. So for those that use mesh in their repairs, you can sleep tight. It does a lot of good for our patients. So with that, I'll thank you for your time, and looking forward to the panel session.